On 28th of July 2025, an incident of stray dogs attacking a girl who later died in the hospital made headlines, sparking public outrage and reigniting the long-standing debate of strays versus human lives. In a little over 2 weeks, the Supreme Court passed an order to round up all strays from the streets of the capital and transfer them to shelters. When protests erupted on the implausibility of implementing the order, primarily due to inadequate and ill-equipped shelters, a modification was subsequently passed. Strays were to be sterilized, vaccinated, and released in their neighborhoods. Only aggressive and diseased dogs were to be confined. For the 35 million people of Delhi, the number of strays on its streets, estimated to be 1 million and on the rise, pose a real threat. The capital's animal birth control program, the ABC, is once again under the scanner for failing to sterilize even half its stray dog population.
Delhi is probably the worst examples of animal birth control program. Because for decades now, the program has been running, of course, haphazardly in Delhi. The MCD has resisted any monitoring or transparency in the animal birth control program.
Animal rights activist Gauri Mauleki points out how this lack of accountability has caused the situation to spiral out of hand.
The sad part is, and it's surprising, that because of Delhi's dog situation, the Supreme Court gave such drastic sweeping orders, but not a single officer in Delhi government or MCD was held accountable. These are programs that affect not only the public health and safety, but also the integration of society. Right now, people are fighting with each other. Neighbors have turned on each other because there's some people who like dogs, some people who don't like dogs.
As Delhi grapples with the issue, we ask a more fundamental question. How do stray dogs become a problem in a city? The answer is not simple. It lies in our history with dogs, in how we treat them, and in how we manage or fail to manage our cities.
They were domesticated from the wolf, right? And the reason they were domesticated is because they used to come looking for food scraps around human civilizations, and over time we realized that these dogs are actually a benefit for us because they help us hunt. They help us kind of protect our civilizations by kind of barking and keeping wild animals away. So this kind of symbiotic existence developed for more than 10,000 years. Some people say about 20,000, 30,000 years as well.
Dr. Asher Yesudos has been working with animal welfare for more than 20 years. He works closely with governments and organizations to frame policies to protect animals.
Any animal, if it grows around a human being, will learn to reciprocate the kind of treatment that it is given. So even if you take a goat or a cow and you keep hitting it all the time, it will react to try and defend itself. A dog that is hit, a dog that is abused, a dog that is mistreated will start fearing, will start getting anxious, will start not trusting humans, and therefore in that process might react in many different ways. The first point is the awareness that strays are not a menace. They actually form a protective layer if they're vaccinated and taken care of properly.
In the present day, however, the Indian stray dog remains largely a free-roaming entity. In the absence of an efficiently run sterilization program and left to fend for its daily meals, has increased the risk for human-dog conflict during peak aggression cycles.
Generally, a dog bites because during mating season, when males are fighting over females. So they get really aggressive at that point in time, and generally when a human passes by, humans can get bitten as well. Once a female dog has puppies, again, she tends to get aggressive because she's protecting her puppies. The third thing is when a new dog enters another dog's territory, there are territorial conflicts and there fights happen again. A fourth reason is that when dogs form large packs.
Experts have been unanimous in stating how animal birth control programs are the only scientific and effective model that could solve the crisis. So what makes proper vaccination and sterilization a sure shot way to reduce aggression in dogs and thereby reduce conflict with humans?
First of all, the testosterone levels drop, so the aggression levels for the males go down. They don't go after females during mating season because the females are also sterilized, and plus the dogs don't get attracted after sterilization. So that mating aggression between males stops. The female doesn't have babies, so there's no protective behavior. That aggression also stops.
Historically, in cities across India, the ABC alone has managed to control the population of strays, but the capital hasn't been one of them. At the Sanjay Gandhi Animal Care Centre, Ambika Shukla oversees one of the largest animal birth control programs in Delhi, performing up to 450 sterilization surgeries a month.
It's an excellent program. It's a WHO program, and it has been proven to be the only sensible and scientific way to control numbers, curb biting and eradicate rabies. So when you have an excellent program, badly implemented, this is the result.
Ambika points out how out of the 20 listed centres running the ABC program, most today are operating under dismal conditions and with glaring administrative loopholes.
Tenders were awarded to any old buddy who could affiliate on paper to some organization that had the necessary requirement. There was no checking of whether this team was actually competent enough to conduct the ABC. And the result has been a careless, badly administered program which has not achieved full efficiency, and it has caused enormous cruelty to dogs who are taken, operated under less than perfect conditions, suffer broken stitches, intestines that fall out, early releases, lack of care, swollen testicles.
In this ABC centre in North Delhi, efforts are on to try and decentralize the process of stray welfare. By integrating local communities, dog feeders and dog lovers into the system, Neighbourhood Woof, as the centre is called, is hoping for a more invested participation.
This is what we need. People counting their local dogs. They're way more accurate than any sarpanch or even us as experts on dog catching. Most of the dogs would like, oh, wo aa gaye hai, bhago. Whereas people who live in the area should be included in a census. And now it's so easy, as I said, with technology. So that's the role we are trying to play, bring in caregivers to the program and also improve the program at the state municipal level. So this is actually a very new dog kitchen. Most ABC centers actually don't have it.
The centre carries out about 250 to 300 sterilizations a month. It has also partnered with a restaurant to ensure any surplus food gets redirected towards feeding strays across the city.
So we started with one outlet, and it's made such a difference because the food is not rotting food. It's food that is been consumed by people, and it allows us to save a lot of income on food. It allows a certain amount of mixed food in their diet.
Feeding dogs at an individual level, however, has been a contentious issue. While some perceive it as an act of kindness, many find it a nuisance. But welfare societies point out that regular feeding can in fact make dogs less aggressive and more open to sterilization.
The people on the ground who are doing it out of their own time, spending out of their own pocket, it's like a free labor force. Allow us to do our work so that, the end objective is same for everybody. We want the number of street dogs to come down, and the best way to do it is spaying and neutering so that these dogs don't reproduce. Even a dog lover doesn't want to have dogs in the street. You'd rather, not have them and have them all safe in their houses.
Most feeders are in touch with each other. So one feeder can put you in touch with another feeder. It's a network. So why not take advantage of this wonderful network, and why not put them into the system? Give them roles, give them responsibilities, and give them authority.
In cities where stray dog populations are uncontrolled, it is common to see strays loiter around waste dumps in search of food. Overflowing landfills and dump yards sprawl like open buffets for stray animals, only worsening an existing problem.
Our understanding is that if waste is not well managed in many ways, then dogs will always have a source of food, even if it is very toxic and full of plastics and inappropriate food. It will still be a source of food, and you will continue to have dogs milling around waste hotspot, around garbage vulnerable points, and as a result, no plan around dogs will ever work if you cannot manage your waste.
In September 2025, Delhi introduced a new set of guidelines. These included designated feeding spots, mandatory pet registration and vaccination, and a monitoring body to oversee sterilization programs. But how far or how effectively implementation will go remains to be seen. Meanwhile, until stray populations are properly controlled and human-dog conflicts brought to an end, fear amongst communities will remain. One of the biggest concerns is that of rabies.
While rabies is almost nearly always fatal, it's 100% preventable. So as soon as a dog bites, I think there are some protocols that have to be followed. One of the first things is you need to wash the wound in running water for 15 minutes with soap, right? And then you need to obviously go consult a doctor, get immediate post-bite vaccines, and do whatever the doctor suggests. So don't take it lightly.
Dr. Asher points out how Delhi, along with Goa and Rajasthan, has been rabies-free since 2022, contrary to popular belief. But when it comes to cities that have created a successful model in overall stray management, Lucknow stands out. Its sustained sterilization and vaccination drives over the past 2 decades have drastically reduced rabies cases and stabilized its stray population. Goa, meanwhile, became the first state to record 0 human deaths from dog-mediated rabies, proving that with political will, resources and consistency, humane and effective models can work.
I would consider that Lucknow and Dehradun have done exceedingly well. They have state animal birth control monitoring committees. They have animal birth control monitoring committees at the local level, the local authority level. The infrastructure is great and well thought out. It was designed well, proper budget was provided for it. While inducting an agency for doing animal birth control, they kept the standards high.
Street dogs have lived alongside humans in India for millennia. For Delhi, the choice is no longer between compassion or safety. It is about building systems that allow both. Quick fixes like removal have failed before. Long-term solutions lie in sterilization, vaccination, waste management, and above all, coexistence based on care and accountability.
Thanks for watching Eco India. If you like the story, please give us a thumbs up and subscribe to Scroll.in on YouTube.